Hello, 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 everybody. This is Irina Strunina, and this is our weekly podcast, Diabetically Speaking with Smart Move 360. This is where we meet every week, and I invite usually some healthcare experts to talk about life with diabetes, what people need to pay attention to, what are the tools they could use, what are the tricks they can use and my experts could be from different areas of expertise. There are doctors, there are nurses, dietitians, they could be life coaches, they could be coaches in different disciplines, but all of us every day meeting with people who have this challenge, health challenge. So every suggestion may work for everybody. So today I have a expert that we met just recently, and I thought, listen, Dot, we have to meet because my people in our audience, they have to hear you. So welcome to our podcast, and please tell us about yourself.
Thank you, Irina. Thank you for having me here. It's great to be able to speak to people. You're doing wonderful work. I am a movement therapist. How that translates is movement is healing. Movement heals lots of things. Movement heals back pain, knee pain, shoulder pain, hip pain, you name it. Movement can heal it. And the thing I'm focusing on now that's making me super excited is osteoporosis can be reversed with the right kind of movement. So I'm teaching the top things that people can do to reverse their osteoporosis, and some of them look suspiciously similar to things that people can do to reverse their diabetes.
Absolutely. Yes. And you see, my company name is Smart Move 360. I am all about movement. Until you start moving, doing something towards your health goal, nothing will change. Doctors can prescribe a lot of medications, dietitians can give you the lists of different menus, but until you start taking active part in all these schedules, nothing will happen. So moving towards your goal is very important. And physical moving your body in any direction is crucial part in it. And unfortunately, as we all know, well, it's changing now, but for years and years, it was that diabetes is often related to the age, and people would say, I cannot move. No, okay, I got diabetes because I got old, and I cannot move now because my joints do not work, my bones are weak, and I have osteoporosis everywhere, and that limits my movement, and therefore I am doomed to live with diabetes. So this is, to me, it's such a direct link to know how to eliminate your pain so your movement will get much easier and will help you in fighting with diabetes. So what would you say in your experience, how
Um,
doomed people are with these health related issues, the age related issues like osteoporosis? You said you can reverse it.
it's reversible. Diabetes is reversible. Osteoporosis is reversible. It takes some doing. There's a saying, if exercise were a pill, everybody would be taking it
Yes.
because the benefits of exercise are enormous, huge. The list is huge. The
Mhm.
things that get taken care of with the right kind of exercise, because it's so common that people need strength training, so they do cardio, or the opposite, or they
Mhm.
think they need to be doing way more than their body is able to.
Mhm.
One of the reasons, there are many, one of the reasons I'm very successful is I make the ramp
Mhm.
very gradual. So
Mhm.
you're here, we put
Mhm.
you here. I don't try to have you go here.
Yes.
Wherever you are, we do this much.
Mhm.
And the next week, we do this more much. They call 1%. If you
Yes.
shift what you're doing 1%, the cumulative effect is huge.
Yes.
So everybody can begin to move, no matter how debilitated you think you are. Everybody can move. Almost everybody can do this. For example, if you think you can't get up out of a chair, if the shoulders are crappy, maybe they do this. There's a
Yes.
place to start. I call it the wedge in the door. You get the wedge in the door, and it just goes more and more and more. So many of my students are like, I never thought I would be able to do this because it seemed too many steps away.
Yes.
Recently, one of my students said, what you're really good at is just inviting us to do a little bit more and a little
Uh-huh.
bit more and a little bit more. And one day you wake up and go, wow, look at all the gains I've made.
Absolutely. Yes. What is the saying that the way of thousand steps begins with the
Right,
first step, right?
right, right, right.
So it's exactly what I am also so passionate about. Start moving. And you were talking about 1 degree, 1 degree, 1 degree. The same thing, the Smart Move 360 is for the same exactly thing. If you continue improving 1 degree, before you know it, you are, arriving in a new orbit, in a healthier, you see more, you're able to do more. So this is great approach, and I'm so glad to hear about it. So let's talk about the fact a lot of times I know that people who have diabetes, they also have a lot of different other issues. Not everyone, but many, especially when it's also later in life. Say somebody at 35 can do much more than somebody at 55 or 75, right? So because the body is holding on as long as it could hold, and then at a certain point, if you don't do anything to help your body, it starts like, okay, I'm not doing this anymore for you. You have to take care of this, right? And then the further you push it away, the change in your lifestyle, the more your body will say to you, no, not doing that either. And then we find ourselves in some very unfortunate situation. So, or sometimes it's just a surgery that may make people not as able to move enough. So in your experience, for somebody who did no exercises in all their life, and then they found themselves that they cannot move the tea kettle to pour the tea in their cup, right? Or they cannot pick up their grocery bag because their old joints hurt, because they cannot do this. What they can start with? What would be your like very, very general recommendation for people? What changes they could start making?
That's a weird question
No,
because
sorry.
everybody's in a different place.
Yes.
But nobody landed where they are overnight. It
Hmm.
might seem like
Yes.
it changed overnight. Maybe you could get up out of a chair yesterday and you can't get up out of a chair today, but that's a process that's been happening for a long time.
Hmm.
So, anywhere to start, anywhere. For someone who doesn't exercise and starts to move, needs to start to move, I think I'm going to go down a different road in a minute. But this is movement.
Yes.
I have done exercises with people in a chair where you move your neck from one side to the other. There are some people in the industry who say all of us should be doing 5 minutes of neck movement every day just to loosen up, your neck's connected to your spine. So, but there's a ton of stuff you can do in a chair. And if you're better than doing something in a chair, well, then start marching. You can march in a chair.
Yes. And it's actually a good exercise. I do it
Very
sometimes. I'm
good.
sitting at the computer and periodically, like, okay, I need to do some movement, but I cannot leave the computer. So I do this kind of marching and I feel the muscles that my
Well, and you
belly
can.
muscles are working and my back muscles working when I'm just marching, sitting in a chair.
Yeah, there's a ton of stuff you can. There's a one of the best abdominal moves, which nobody does any abdominal work. One of the best abdominal moves is just pulling your belly in, pull it in, pull it
With the
in.
finger
You have
or
to keep
muscle?
breathing.
Ah,
No, no,
okay.
I'm pulling in. I'm
Uh-huh.
just showing you with my finger that it's moving. You pull in, you
Yes.
let go, you keep breathing in. Now, people tend to do this backwards. You want to pull your belly in while you exhale. So blow out, blow out,
Yeah.
blow out. It's a phenomenal exercise. It works your core. Everybody knows core. Oh my God, I can't do that. But you know, Irina, along with the exercise, they're both like so important. The food has to
Oh,
change.
yes.
The food has to change. There's a saying in the fitness industry that the best workout program will not make up for a crappy food plan.
Mm-hmm.
So the food has to change, and food can change, you know, this much at a time. I was talking about how bad sugar is, which is true for diabetes and osteoporosis, and a long list of other things.
Mm-hmm.
And a woman asked me, well, I only eat one cookie every day. I'm like, okay, that's 7 cookies. How about 6? How about 5? How about once a week? I mean, you don't want to be eating sugar every day, period. But if you do, maybe you can figure out a way to do less of it. So, same thing, little changes. So, because the body will move, all right, so you can do some neck stuff. Here are some great neck moves. Inhale, move, exhale. For people who are very sedentary, you need to move back and forth a little bit. There's a saying, motion makes lotion. You need to move to get the oil in the joints. If everything's just too creaky, you move and come back. Over time, you move and hold. Ear to the shoulder, same thing. To get the neck stretched out. You were talking about people being on a computer. I encourage people to stand up at their computer. I have a standing workstation and an option to sit. For people who are really deconditioned, they'll stand for 2 minutes and it'll be too much
Yeah.
or enough,
Yeah.
you know? So, and I jerry rigged my workstation. You get a box to put your monitor on. They make these things now called standing desk where you can just put your
Yes.
computer and it moves up and down. Or you do it your own way. My laptop sits right here, but my computer is right here where I stand. I encourage people to stand because we sit too much as a culture. There's a saying, sitting is the new smoking.
Yeah. I've heard
We're
that.
too sedentary. So just standing 1 or 2 minutes every hour, 1 or 2 minutes, 1 or 2 minutes. So many of my clients tell me, I can't stand all day. Well, don't. I mean, I stand all day and I'm in my 70s.
Mm-hmm.
But you start by standing for a minute, and in another couple hours, stand for another minute,
Yes.
and another couple, and you build. You build on what you can do.
Mm-hmm.
So
That's
there's
right.
some interesting beginnings.
Yes.
For
Yes.
people who are a tiny bit in better shape, walk. I remember starting with a man who couldn't walk to the end of my block. I'm like, okay, we'll walk halfway to the end of the block. We'll walk 10 feet if that's what you can do. Get up, go to the kitchen, come back. Whatever you can do. And each time we built and built and built. And he walked miles by the time he was done with me. Never in his wildest imagination would he have been able to figure that out. I could just tell you stories and stories of where we start. There was one man, no matter what I gave him, he wouldn't do it.
Mm-hmm.
And so I said, I'm going to call you in the morning. Every morning, I'm going to call you. 8 o'clock in the morning, I called him every morning. Get up. All you have to do today is swing your legs over the side of the bed and put on your sneakers. And
Mm-hmm.
after a while, he got in the habit of putting on his sneakers. I'm like, go outside. And I'd wait. I'm like,
Mm-hmm.
go outside. And eventually he went more and more and more. We did this for months until one day he's like, I found me a walking buddy up on my hill. And when he went to the doctor said, I don't know what you're doing, but your cholesterol's better, your blood pressure's better. Just keep doing it.
Yeah.
You know. So
Awesome.
walking, people can just start walking.
Yeah, yeah. It's interesting. I know the story of someone, this lady, she committed during the COVID. Everybody is at home, and her working desk is upstairs, while her bedroom is downstairs. And she had to go to the office to work there, right? But she has issues with her joints, with her, like a lot of health issues. And so, but she's committed to keep showing up at work, and she was climbing those stairs to the upper floor, and she said that in the beginning when I started, I would be just going like 3 steps and stay and catch my breath, 3 steps and catch my breath, and then stay the whole entire day upstairs, because to do this twice a day, it was for her a challenge. But then few months later, she just came online and was like, I cannot believe it. I actually went upstairs the whole way up without stopping once. I can do it. So now I can actually go up and down. Of course, not running, jumping, over the 3 steps, but I can go up and down. And this is how I conditioned myself this way. So it's a lot of things we can do to, as long as we want to. I you got to find a reason why I want to do it, right?
One of the biggest things for osteoporosis is weight training. That
Mm-hmm.
what builds the bones, you need to build your muscles to build your bones. The bones respond when the muscle has a load. And you can do bicep curls in a chair. You can do
Yeah.
shoulder presses in a chair. You can do tricep extensions in a chair. Now, the legs are more important than the upper, but we use little loops, and you can do legs with a little loop in a chair. So, there's a place for everybody to start. And as far as joint pain goes, I think people don't realize that the food choices they make have a lot to do with joint pain.
How
People
come?
assume that joint pain is physical and it's about movement, which it is in part, but there's a huge food component to joint pain.
Well,
One is
here's the
sugar.
question.
Sugar is inflammatory. You have to take out what's inflammatory. Joints hurt when they're inflamed.
Yes.
Sugar is inflammatory. Gluten. And there's the same for diabetes,
Yes.
osteoporosis. Gluten is the next one. I have so many stories of people with different mixed connective tissue disorders in their various knees, shoulders, whatever. And you take the gluten out, and the joint pain disappears. The next one is dairy. That doesn't mean everybody needs to stop eating all gluten and all dairy, but you at least want to find out if you're someone who's getting inflamed. And you can run inflammation markers. You can ask your doctor, run me an inflammation marker, homocysteine or C-reactive protein. I mean, there's different tests you can take to see, is your
Hmm.
body full of inflammation? Because inflammation is going to make you hurt. And
Yes.
what does it take to bring the inflammation down? Um, And then the nightshades. People don't realize the nightshades are for some people live in the joints. I've had clients, they're flat on their back the day after they eat white potatoes, tomatoes, potatoes, white potatoes, green pepper, and eggplant. They're called the nightshades. Not everybody's sensitive to them. They're healthy foods.
Hmm.
But if you're sensitive, you need to get rid of them. And that's a piece of information that you can find out.
Oh,
So I try to teach people different kind of information. Find out if this is true for you. Find out so we know, why is your body inflamed if it's inflamed, and let's get rid of the things that are probably hurting you and hurting your bones.
so is there, it's always a test, or you could experiment at home, like stop drinking milk for a week and see if you're feeling better?
That's
Or how do you learn about?
an interesting question. So, inflammation is a blood test. You can run blood tests for inflammation, sed rate or CRP or homocysteine. All of those will give you inflammation. But to find out if you're sensitive to something, here's the way to test it. They say 4 days,
Uh-huh.
4 days. Eat nothing but steamed vegetables, maybe brown rice. My body doesn't like brown rice. Maybe a little protein. Not to eat little, but to eat very few different foods. So you've now cleaned out your body, and that might be too hard for some people. But lots of vegetables, maybe soup, maybe, right? Clean out your body and then test one food. So after your body's clean, 4 days of that will clean out your body. And you test one food and you'll know. There's lots of different reactions people have to elimination testing, but you'll know right away. Either the tongue gets itchy, or the hands start to shake, or you get a stomach ache. Nothing horrible. You're not going to go into anaphylactic shock,
Yeah.
but you'll have a reaction that's noticeable, like, or you won't, right? So if you have like, I don't feel anything, you're good with that food. In the afternoon, you do it again. And then your body's considered poisoned, dirty. You need to do 4 more days. So every 4 days, you can test 2 foods.
Mm-hmm.
There are places you can go that will test your
Yes.
food, that do sensitivity testing. I have a personal nutritionist who does that. Doctors have different about it. There's lots of different ways of doing it. But on your own,
Mm-hmm.
you can try to do what you suggested, which is eliminate the food and then put it back. But hypothetically, let's say I'm a person who eats a ton of sugar and
Mm.
I want to know if I'm allergic to milk. So I stop drinking milk for a week or a month, and then I reintroduce it. My body is so poisoned from all the sugar I'm eating that I don't notice whether or not I'm sensitive to milk. And that's why you do that clean out. If you
Yeah.
just eliminate a food and reintroduce it, it's a little bit it's a little bit like going into a Las Vegas casino, which is full of smoke,
Uh-huh.
and then trying to smoke to see if it bothers you. It's like, well, the air is so full of smoke, you can't tell if smoking bothers you. It's sort of the same. If your system is that polluted, you're not going to notice.
Oh yeah. Oh yeah. Yeah, it's hard to find if in the muddy water, it's hard to see if any like adding a blue dye if it changes anything.
Correct.
But if
Correct.
the
You got to
water is
clean it first.
clear, then we
Correct.
could see it, right? So
Correct.
okay, makes
Yeah.
sense. Makes
Good
sense.
analogy. So it takes more than just I have clients who do that. I stopped eating bread for a week and I didn't feel anything. It's like, right, because you drink a bottle of wine every night.
Hmm.
Alcohol, caffeine. I never start with those. Never. I live in a county where wine is very popular.
Uh-huh.
Like, there's better places to start. Don't worry about your coffee and your booze unless you're drinking inordinate amounts of it.
Yeah. It's
Water, 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 water. That's a great place to start. Add a cup or two of water because most people don't drink enough.
hmm
If your pee isn't clear or close to clear, you're
Yeah,
not drinking enough water.
that's
The
right.
test for water? Yeah. You take your skin and it should go right back down again.
Okay.
So if it
Goes
stands
it
up,
goes down. I'm glad.
if it stands up, it stays up, right? You're
Yeah.
dehydrated. Most Americans are dehydrated.
Okay.
There's a, yeah, there's a lot of things like that that are a little
Simple.
easier.
Easy things that we can start implementing like right now.
I'll tell you for osteoporosis, probably that's true for diabetes too. Do you know what percentage I only know about Americans, so I talk about Americans, um, are deficient in vitamin D?
No, I don't.
It's like 90%. And
Okay.
part of that is because we're slathered in sunscreen all the time, so we no longer get vitamin D from the sun, which is where you get it. But almost all Americans are deficient in vitamin D. As far as osteoporosis is concerned, you need vitamin D to absorb calcium.
Hmm.
You don't have enough vitamin D, you're not going to absorb your calcium. So And that's a blood test. You can ask your doctor, test my blood.
Yes.
So for people with diabetes, they're not exempt from that percentage.
Oh,
They're
yeah.
probably low in vitamin
Absolutely.
D, and you
Yes.
feel so much better when your vitamin D is up over 50, which is higher than what the mainstream recommends.
Yes. Yes.
But that's a simple test to take, and vitamin D is an easy pill to take. You take in the morning with food.
Yes. Yes.
So, I mean, there's a lot of different places to start. As far as osteoporosis goes, balance is really important, and you can start balance anywhere. You just stand up and see if you can balance on one foot because you
Hmm.
don't want to fall and break a bone.
Yeah.
Um, I don't know the percentages of people with diabetes and osteoporosis. I don't know that. How many
Yeah.
people have
I can
diabetes?
tell you that the official statistics are telling that 10% of population of United States have been diagnosed with type 2 diabetes.
I
Uh,
think the number's much higher.
well, officially diagnosed.
Yeah, because so many people are pre-diabetic and or have
Pre-diabetic
diabetes.
is much higher percentage, but 93% of them don't know that they have this diagnosis. So
That means they're not getting their sugar checked.
the, or doctors are not letting them know. Sometimes I see that cases as well. So a lot of people have this problem, and but officially it's 10%.
The same is true with osteoporosis. They don't test you, and so you don't know.
Hmm.
And if you don't know to ask to be tested, for diabetes, you want to read your A1C.
Yes,
What's the hemoglobin A1C? For osteoporosis, you want, unfortunately, the standard of care is DEXA,
yes,
X-ray to
yes.
see how your bones are. But so many people, they're 70 years old, and the doctors just give them their first DEXA, and their bones are terrible. Why didn't you test me at 60 or
Hmm.
50? They won't test you at 50. They'll test you at 60. But yes, everybody should get a baseline DEXA as soon as the doctor will let them. Everybody should get their A1C tested and understand what it means.
Exactly. This is why we have this Facebook group, Diabetes 101 for Beginners. When people get diagnosed with diabetes, the doctor's office will call them like 3 days after the visit saying you have diabetes, your A1C is 8. Prescription is in the pharmacy, let's schedule the follow-up in 3 months. And people like, eight what? What does it mean? I don't understand. So
Right.
doctors often do not take time or don't have time to actually go over the results of the blood work to explain what is going on so people will understand what is going on. So I'm suspecting similar situation with
Exactly
the
the same is true for osteoporosis. The point of a test in the medical profession is to put you on a drug.
Mhm.
People don't realize that. The whole point is to put you on a drug. So osteoporosis, it's like, oh, you have osteoporosis, here's your drug. It's a different drug than they put you on for diabetes, right? But
Yes.
same thing, no explanation of what the numbers mean or any information about what else you can do about it.
Hmm.
Both of these conditions, well, diabetes is totally reversible.
Yes.
Osteoporosis, you can reverse the process. You'll never go back to your bones the way they were when you were 30.
Yes.
But all you want to do is get them strong and stable. Strong and
Exactly.
stable, they're not losing anymore. That's all you're looking for.
Absolutely, Dot. I am so sorry because these 30 minutes are flying. So let's go over a couple important points. Please let us know where people can find you if they want to learn more and maybe get some conversation going on with you because we have a lot of people who may use your expertise to help themselves.
So I'm going to do a share screen. My
Okay.
website is getoutabackpain.com. This is,
All right.
so this is a group I run every month. But the easiest way to get a hold of me is here. Just go to the main website, getoutabackpain.com. and it looks like this, where I send you a free report about back pain.
Uh-huh.
But at the top, there's osteoporosis. That's a free workshop I give. The next one will be in July. This is a 4-week information series I do. A lot of help you along what do you need to do. And the wellness program is a monthly group. So if you wanted to start right now, those are 3 different options. We're meeting this week, actually, the wellness group. So that's the best thing. There's a contact, contact me on the website. So, and I think you're putting that in the chat. Is that
Yes,
right?
I will put it under the video in comment section so everybody will have access to it. We also will have this video on YouTube, and everybody could go ahead and check this out. Mark your Smart Move 360 is the channel, so like it, mark it, so you will not miss the next video. And I would strongly recommend to go back and see how many interviews with wonderful people, experts in what they are doing. They're passionate about their area of work, and check those videos as well. And I just wanted to remind our viewers, our listeners, that in our Facebook group, we have these activities. It's called Telenurse Tuesday. Every Tuesday, one of our registered nurses goes online and answers your questions if you have something related to your treatment plan. On every other Wednesday, we have support group meeting where you could go ahead at 7 p.m., log in on this Zoom meeting, so it's not in the Facebook, and the link is always posted in our Facebook group. On Thursdays, we have our podcast, Diabetically Speaking with Smart Move 360. And I also wanted to let you know that we run this 2 hours crash course once a month, Diabetes 101 for caregivers, for people who don't go to doctor's visit and who are just trying to help. So to educate yourself, join us for those meetings where Kim Kyle, our registered dietitian, and myself talking about what information you may need. It's once a month, and every other month we have our Diabetic Healthcare Expo, which is happening in the last Saturday of every other month. So the coming up in April, we have the one on April 26th. And this is where you could meet with experts like we have today, like Dot, like many other people who can help you to get situated and start doing something, start making changes so you could get better control over your diagnosis. And with that, I am excited that we had this conversation. I'm sorry it was not enough time, but trying to stay as close to 30 minutes as we can. We're already over that. So everybody, please stay healthy. Everybody, please keep moving. Listen to our podcast. Meet with our experts. They all are accessible, and see if there is the help that you are looking for and that will work for you, for your schedule, or maybe you know someone who may use that help. That also is a good idea to do. Sharing is caring. Have a great day. Dot, thank you again for joining me today here, and I will meet with everyone next week. Have a great rest of your day.